For the first time in 2 months, the United States is averaging more than 100,000 new COVID cases a day. This according to new data from Johns Hopkins University. Deaths are also rising with an average of 1,600 fatalities each day. In Kalispell, 9 additional deaths were reported yesterday and 29 for the state. Now, the numbers may not be a surprise since it comes after millions traveled for Thanksgiving. And the Montana Nurses Association is making another plea for help to do more to support nurses on the front lines in the Treasure State. MTN's Andrea Lutz explains.
COVID cases continue to remain on the rise, and of course our healthcare workers are feeling that pressure. Well, those at the Montana Nurses Association say they'd like to see some financial perks coming to our nurses that are already working in state now instead of for enticing those out of state. In a pandemic that seems to keep lingering, more Montana nurses are turning in their scrubs.
It's heartbreaking. So
Vicki Bird with the Montana Nurses Association says for a profession that was already short-staffed, the stress of COVID-19 has nurses quitting their jobs.
it's unfortunate.
We've seen the impact in November. Billings Clinic had 120 open nurse positions. At St. Vincent, that number around 84.
Many are retiring early. Many are quitting and not even coming back.
Bird wants to see more resources and perks coming to those nurses already working in state.
You know, how do we invest in the nurses on the ground? And in all honesty, it didn't help when the governor put out, we're going to invest in out-of-state nurses and healthcare workers. My phone rang off the hook. We've been asking since March to invest in our nurses on the ground.
You may remember back in November, the governor announcing an incentive program to help curb burnt-out frontline workers, offering $12,000 in reimbursement moving expenses for coming to Montana.
Has there been any back and forth with him since that?
Right. We've been asking since July for a meeting to talk about nurses and COVID, but we've asked over 8 times. But we're going to continue to ask. We're right here.
But Gianforte's staff says that's not necessarily the case. Instead, the program has received support from dozens of healthcare leaders across the state, and it's a long-term solution to staffing. But Bird says Montana nurses are also getting enticed to quit their jobs and move on.
Come to Indiana, 60,000. Come to Texas, 40,000 sign-on bonus. So we have got to invest in our nurses here.
She's hoping the state will start to funnel money to current Montana nurses who want to stay here. In Billings, Andrea Lutz, MTN News.